Welcome to Coffee, Calm and Connection Bite Size, where we deliver key takeaways from our full interviews on current topics from mental health experts.
The fundamental idea is very simple, really, as coined by Beck, who was an American psychiatrist in the late 60s, early 70s, I think. So it's just basically saying that when you are faced with certain events, it is not those events which determine how you feel, it's the way you interpret them.
Yep.
Is a thought that comes to your head about it that makes you feel that certain way. But we normally talk about these things like, in a way, we say, I've been somewhere, I've met that person and he made me feel. That's the way we talk about it, as if events made you feel a certain way. And his fundamental idea is no, it's not the events themselves, it's the way you interpret them. But that interpretation is a lot influenced by your upbringing, your environment, your culture, a lot of other things and your unique schema, your unique way of thinking, and that kind of type of style of the way you perceive the world, really, the lens from which you see the world. That's your own kind of interpretation, attaching meanings to things.
Mm.
So that's basically what CBT is, cognitive therapy is. I mean, the behavioral element existed before the cognitive therapy came to existence. And that was very much, it is the Pavlovian kind of dog experiment. I don't know if you know about that one. It's about the meat.
Yeah.
So it's that kind of association you get with some primordial kind of feelings and an instinct that is linked to, in a way, our senses linked in a way to reward. So it's whatever you're being, that can reinforce certain behaviors or otherwise discourage people from taking certain behaviors. So the cognitive therapy idea took off as cognitive therapy, but later on people realized there's a lot of behavioral element to this, so they combined the two together. But cognitive therapy was originally about the way the way we interpret things, and the meaning we attach to things is what determine how we feel about things.
Yeah. No, that's really interesting.
If we experience strong emotions, we need to change the way we think about things. That's basically it.
And I suppose that is done over time with small incremental changes and sort of process behind it to form those habits, those neural pathways.
Yeah, I mean it's quite a personalized. So CBT works on your problem rather than giving you a already preformed diagnosis to say this is what the problem you have. So in terms of the psychiatrist, the medical model, we say you've got this symptom of depression, which you feel low, you feel tired, you lose interest in things, you're feeling hopeless and helpless, you're feeling guilty, therefore you have depression. Whereas that's what the psychiatrists say. You've got these symptoms, you've got depression, I'll give you this medication, it'll help you to get better. But the psychologist would say differently. I need to understand what exactly made you to be more inclined to think this way if you are faced with loss, for example. Why would you feel very depressed? So we need to look back at your childhood, your upbringing. We need to look back at your family history of psychiatric problems. Maybe you have a high genetic loading of these problems. Maybe you were faced with too many losses when you were young. And that's what made you prone to these problems, because it made you have this idea that you're always going to you're going to fail or eventually, or that loss is going to be, you're always going to be faced with some element of loss in your life. And that's the idea of the lens or the schema. That's what really that's your kind of your blueprint. That's how you think and respond to think. That's your unique way of reacting to things in your own environment.